So they thought I was depressed, and I had to go to a depression clinic once a day a week to receive therapy. Turns out my thyroid was botched up. Hi, my name is Natalie and I'm the founder of the Unchargeables chronic illness support group. And in this video, I'm going to tell you the story about my pregnancy and how it messed up my thyroid. So if you're interested in more stories like these, where I tell you in detail about all the crazy health stuff that has happened to me, subscribe, give me a thumbs up and a little heart. When I was 19, I was diagnosed with Graves' disease, which is an autoimmune disease of the thyroid, and your thyroid goes faster than it should go. So you're hyperthyroid. When I had that, they didn't tell me that pregnancy affects all things thyroid. But I did remember, obviously, that I had all these treatments, and even though the doctor told me I was cured, I told my midwife that I've had some thyroid issues in the past when I was just about 13 weeks pregnant and had my first consultation. So I'm Dutch, and in Holland we work with midwives when you're pregnant, and they're a big believer of home births and to try and do everything as natural as possible, which obviously you can go to the hospital as well. So yeah, I had my first consultation, and you have to fill out this list, like all diseases on your mom's side, all diseases on your dad's side, and any diseases you've had in the past. So I did tell them, well, I had this thing on my thyroid, but they told me I'm cured, but I still wanted to mention it anyway. So they took that in and they put it in my file and didn't do anything with it. So they just did the normal blood test, which does not include thyroid in Holland. And off I went. But in the first trimester of my pregnancy, I was so extremely tired, but way more than normal. I could only stay awake for about 3-4 hours per day, and the rest of the time I would be sleeping. And when I told my midwife that, she's like, well, the first 3 months of the pregnancy are the most important ones, so you should actually just be resting as much as you can. I'm like, but is it normal that I can only stay awake for about 3-4 hours? That seems very excessive to me. She's like, well, everybody's different, so just go with it and you'll feel better. Then the nausea started. I think I was about 10 weeks pregnant when the nausea started, and they're like, well, when you hit 12 weeks, it will be better. They're like, well, sometimes it goes on until 14 weeks. At 14 weeks, I was so nauseous, I couldn't eat, and I was starting to lose weight, which obviously is not something you want to happen while you're pregnant. So they kind of started it to take it a little bit more serious, and when I was 16 weeks pregnant, they gave me medicine to lower the nausea so I could eat something. That kind of helped, but the nausea didn't go away. And also, I didn't only have morning sickness, I was just nauseous all the time, all day long, every day. And that lasted until I was 26 weeks pregnant. By then, obviously, you could see on the outside I was pregnant, and while I was happy to be having a baby, I was not happy. I had this dark cloud like above my head all the time, and I had a very bad mood, and I just was very unhappy, and I didn't really know why. I was less tired than in the first trimester, but I was still really tired. Everything was hurting me, and you know, I kept going to the doctor like, I understand there are pregnancy symptoms, but this all just feels very excessive. I don't know any other moms to be that are this kind of like, it wasn't depressed, but in a bad mood and unhappy about everything and wanting to fight about everything and not wanting to do anything but just lay down. But then when you're laying down, you're really bored, and I don't know, I was just very unhappy. When I was 26 weeks, that finally started to fade, and I'm like, oh, maybe I can finally get to the part where I do feel better. And it was going kind of okay until I was 32 weeks pregnant. I was still working at the time for my job, for my boss. And we had this dinner with all the co-workers, and I started getting these sharp pains in my belly, and I started to walk back and forth in the restaurant. So all my co-workers were really nervous, and they're like, "You're not gonna have the baby here now, right?" I'm like, no, I'm just gonna walk it off. I'll be fine. After an hour of walking back and forth in the restaurant, my manager was like, maybe you should go home. And my mom came and she picked me up and she took me home with her. The next morning, these sharp pains still weren't gone. So I went back to the midwife and she told me, the baby wants to come out and it's 32 weeks, so you're way too early. You're on strict bed rest. I'm like, excuse me? Yes, I was on strict bed rest until 38 weeks. So for the 6 weeks that followed, I was kind of like an incubator. That's how I felt. My mood worsened. I was more and more unhappy, and I just wanted to have this alien baby out of me because I was done with this. I must say that this midwife gave very good mental counseling and support. And she would come to my house and tell me, well, you think about it now, but if your baby's going to be born now, it will be premature and you'll have all these worry. And it's very hard being stuck in bed, but you know, you're doing this for your child and you'll be fine. This is just temporary. And when your child gets born at a normal, stage, you'll feel better about it. So I did listen to her. They never did any more tests. So they never checked anything extra. They just told me it was all pregnancy symptoms. And then the day came that I went into labor. And I'm like, yay, let's go to the hospital. That's not how it goes in Holland. So the midwife comes to your house and she checks how far along you are. And she makes the call if you can go to the hospital or not. And she told me, nope, you're too far along. Because it's going really fast. You cannot go to the hospital. You're having your baby at home. I'm like, what? I don't want to have my baby at home. But you know what? You can't really do anything. So I just went with it. I'm like, okay, let's do this. I'll just have this baby at home. But the baby did not want to come out. So after about an hour of trying to push her out, nothing was happening. And the ambulance was called. Yes. So I lived in Amsterdam, in an apartment on the 4th floor. And if you know houses in Amsterdam a little bit, the stairs are like really steep, but really steep. But I had practiced because I'm like, if I have to get down these stairs while I'm in labor, I'm practicing these freaking stairs. So when the ambulance was down, this was the 15th of January in the middle of the night. And it was snowing in Holland at that time. So the ambulance was there and they told me, okay, whenever you don't have a contraction, go down the steps and into the ambulance. And I was like, now, I can do it now. So I ran down the stairs and I reached it in time for the next contraction. And they're like, where did she go? Apparently I went out in my bare feet, just wearing a t-shirt. I didn't even notice any of this. And then they told me, stop pushing. I'm like, how? That's not even possible. So during the whole ambulance ride, I'm in this ambulance with 3 men, telling a woman in labor to stop pushing. That is not happening. It's like impossible. Anyway, long story short, we were in the hospital. In the end, I had a cesarean because they tried to get her out for another hour. Oxygen was starting to get low. My contractions were stopping basically. And I was like, oh, I feel much better now. And they're like, oh, that's a bad sign. So they rushed me into the operating room and I had a C-section and my daughter was born. I was really happy to see her, obviously, after she was born. But my recovery was so slow, so slow. They kept telling me, well, if you can stand up and go to the bathroom by yourself, you can go home. And after 4 days, that was still close to impossible. I couldn't move my body. My body was so exhausted that I couldn't move it. While at this time, I did not know I had a whole bunch of autoimmune diseases. So I just thought, why am I so tired? Why is my body not moving, right? So with the help of my then husband and my mom, we managed to get me to the bathroom and get me released from the hospital to go home. But I did just tell you I was living on the 4th floor with stairs that are this steep, and now I had to get up these stairs. Literally, my then husband and my mom took my feet and placed them on the next step, and I would pull myself up, and they would place my foot on the next step, and I would pull myself up, and that is how I went up. They couldn't carry me because, you know, I just had a cesarean, everything was hurting. And yeah, so then I was in my apartment, in bed. I was just in bed for 6 weeks before my daughter was born, because she was born at 38 weeks and 2 days. And then I was in bed for like another month, and then the midwife, she came by and she's like, just do it, you know, just get up. Just get up and start walking. Your recovery is going too slow. You should get up. Again, no tests about what was going wrong with me, just all the regular tests they do after you have a baby, and they did with my daughter as well. But nobody was really concerned about why my recovery was so slow and why my mood was so bad. In the days that followed, they did come, like psychologists, they come to your house and sit next to your bed, and the midwife and people from all sorts of, I don't remember, there were so many people coming by because they are checking for postpartum depression. But I was cleared and I was fine, and then after 2 weeks they kind of leave you alone. I slowly recovered, my bad mood was less, and I lost all of the weight that I gained, which was not a lot because I didn't gain a lot of weight because I couldn't really eat. But I lost all of the weight within 10 days after the cesarean. And then what started happening was I didn't have an appetite anymore. I was really tired again, but extremely. And I know new moms are really tired because they wake up a couple times per night, right, to feed the baby and everything. But I was deadly exhausted. Like, I couldn't move, I couldn't think, I couldn't eat, I couldn't walk. I started gaining weight a lot, but I didn't really eat. And it was just all very weird. And then I started becoming depressed. I started getting hallucinations where I was standing on top of the stairwell with my daughter, and in my mind I saw us tumbling downstairs while I knew this was not happening, right? And later, when I felt better and I was able to drive again, I would drive to work, because I went back to work, so I would drive to work. And while I'm driving and really seeing the road, my mind was showing me these images of crashes happening and me tumbling over with the car. It was surreal. It was just the weirdest thing. Then what started happening is I looked in the mirror and I did not see myself. I saw another person. And then when I saw pictures of me with friends and family of before I had the baby, I saw a different person, and only the pictures that were taken while I was feeling like this looked like me. I went to the doctor and said, I don't know what's going on, but this is all very strange and it doesn't feel like this should be happening to me. And the doctor told me to go to this psychologist, and I went there. And I felt like she really didn't take me seriously. So I didn't want to go to her anymore, and I wanted to go to another one. My doctor didn't agree and was really upset with me. And one day I bumped into him in the bakery, and, you know, it was just very awkward and very weird. And I was just very unhappy about it. So I started back then doing my own research. This was about 7 years ago. I started doing my own research. I was looking into depression and depression clinics, and I found a depression clinic in the west of Amsterdam that looked like it would be a good fit for me. So I went back to the doctor and like, listen, so I've done my own research and I found this depression clinic that I think would be a better fit for me than the psychologist you sent me to. Can you please give me a referral letter so I can try? He kind of reluctantly agreed to give me this referral letter. And I went there, and that was the best thing I've ever done. Like, my psychologist, she was just a girl my age that I could just speak to on my level. And she believed everything I told her. She even was researching for me based on all my symptoms. She says, you know, I doubt it's postpartum depression because it's like 6 months after the baby's born, which is really late. You should have had it like straight away. The fatigue you're telling me, that could be probably chronic fatigue syndrome. So go and look into that. She did work with me based on like her diagnosis and told me, look into that, talk with your doctor about it and see what you think. I worked with her for about 3 years every week. And while that did help me, it didn't solve the problem. So we worked on positivity exercises, how to make my world a little bit smaller, how to do mindfulness exercises and come back to myself and my core. But still something was off. At some point, I don't exactly remember when, I think I was with her already working for about 6 months. They did a test and it turned out that my thyroid completely stopped working. Zero, did not do anything anymore. So that explained my hallucinations, my depression, my gaining weight while I wasn't eating, and all of these things. So they gave me the thyroid medicine, Synthroid, that I started taking. In the first 6 months, I started to feel much better. And after a year, I was almost back to my own self, but I didn't really lose the weight, which was kind of weird. And my moods were still on and off. I was still exhausted and in a lot of pain, but it was much better than it was before. Years later, I was actually doing research for the Unchargeables chronic illness community to look more into thyroid issues, because I was thinking back then the community was for people with fibromyalgia, because I knew I had fibromyalgia and that's what I could support people in. And then I realized, wait, I have this thyroid thing as well. I take this pill every morning, but you know, there must be other people with thyroid problems and maybe I can support them too by sharing my story and, I don't know, just offer them some support. So I was doing research about thyroid issues and I stumbled upon this thing called HASHIMOTO'S disease. And I'm like, and miracle babies. And I'm like, what is that? There were these stories of women that were pregnant that had all the same symptoms that I had, that did experience all the stabbing pains in their stomach, but their babies didn't make it. And only like 10% of these babies survived and actually were born into the world, and those were called miracle babies. I'm like, oh my God, I think my baby's a miracle baby. By this time, she was already 3 years old, 4 years old maybe, because this was not that long ago. And I started looking at all the symptoms and the treatments and everything, and I read about a whole bunch of people that were taking Synthroid medication, but this was just not enough for them, and this was not making them feel any better. And there were a lot of people that reported that natural thyroid medication made them feel so much better. So I started looking into that. And I started researching more, reading medical books about the thyroid and about Hashimoto's and understanding everything better. And then I discovered this. Thyrovans. This saved my life. So when I switched my Synthroid to Thyrovans, I got my life back. I wasn't so tired anymore. I didn't have bad moods all the time and mood swings and fatigued and pain and just not happy about life. I could move, I could walk, and I felt so much better. The lesson I got from this is, even though your doctors may know a lot and they have studied for a very long time to become a doctor, do your own research, be your own advocate, and make sure that your medical treatment is correct for you, because everybody needs something different. Listen to your body, do your own research, and try to work with your doctor. That was my crazy thyroid story. My daughter is now a happy 7.5-year-old. Here you can see her. Isn't she lovely? and we are just super happy together. So if you're interested in more stories like these, where I tell you in detail about all the crazy health stuff that has happened to me, subscribe, give me a thumbs up and a little heart, and I'll see you in the next video. Bye!